What's up, good people? So, question of the day is, can diabetes lead to blindness? Let me be very clear here. It could be type 1 diabetes or type 2 diabetes, juvenile onset diabetes, or any of the diabetes, okay? So, the question is, could diabetes cause blindness? Unfortunate answer to this question is yes, it can. But the good news is it is preventable, it is treatable, and it is something that you can do about it. Look at the eye. The normal eye is on the top here, and that's how a good eye looks like. But if a patient gets diabetes, this is how ugly the eye could look like. You see exudates, you see problems in there like fluid accumulation and the swelling in the back of the eye, especially at the fovea, and that's what we refer to as diabetic macular edema, which is one of the leading causes of blindness from diabetes. Another reason of blindness, a potential reason of blindness in diabetic patients, could be from something called diabetic retinopathy, and it has types and classifications. On a bigger spectrum, we classify or separate that into two types: the proliferative diabetic retinopathy and non-proliferative diabetic retinopathy, NPDR. And when we are dealing with diabetic retinopathy, this is the kind of rough picture that we see in the back. Like we see hemorrhages, we see microaneurysms, we see cotton wool spots, and we see abnormal vessels. And a very dangerous form of that is proliferative diabetic retinopathy, because that can even lead to vitreous hemorrhages and retinal detachments and a lot of problem like tractional retinal detachment, and then patient can end up with a blindness. But the good news is we have laser treatments, we have injections in the eyes that we can give, and we can prevent it by having a strict control on blood sugar level. So there are a lot of ways to prevent the blindness that can happen in diabetes from these big factors or big problems, which is diabetic macular edema or diabetic retinopathy. If you are one of those who has diabetes and is concerned about it, please write me in the comment section and tell me about your experience. If you have got DME in the past and got treated or not, or you got diabetic retinopathy, I would love to hear back from you and see what you have about your story to share with us. Thank you so much. Have a great day. Bye-bye.